Welcome to Herbally Yours, an adventure into the world of natural medicine. Here is your host, Dr. Ellen Kamhi, the natural nurse who will help you take the leap to ultimate wellness.
And greetings. Thank you so much for joining me, Ellen Kamhi, the natural nurse, for another edition of Herbally Yours, right here on the voice of Nassau Community College, 90.3 WHPC. Herbally Yours brings you the latest information about the many facets in the world of natural living. And through health media, we really like to have guests on who join you at navalexpo.com. You can visit navalexpo.com to find out when the next Naval Expo is going on. These are live events, both in the New York and Long Island area. And you will meet many of our guests that we talk to here on Herbally Yours. For instance, my guest today is one of those, and his name is Dr. Joseph Bosiljevac. I'm not sure how to say that, so we'll call him Dr. Joe. And he graduated from Emporia State University with a degree in chemistry, and then went on to medical school, graduating in the top 10% of his class. And that was back in 1975. He was elected for membership in the Honorary Society, Alpha Omega Alpha. Dr. Joseph, I'm going to let him say his last name, is a fellow of the American College of Surgeons, and in 2009 he achieved a PhD in natural medicine and began a wellness practice with an emphasis on promoting health and longevity. He has been certified in age management medicine and works with Cenegenics Medical and Research Institute. He is also a member of the American College of the Advancement in Medicine, which is known as ACAM, and he is certified in chelation medicine. And he is the author of a beautiful book that I have right here that we'll be talking about also, Surviving Cancer, the Use of Complementary and Alternative Medicine in the Treatment of Breast Cancer. Thank you so much for joining us today, Doctor.
Well, I'm pleased to be here, Alan.
Now, could you tell me how to spell or just pronounce your last name correctly?
Bosiljevac. There's a J in there, and the name is Croatian in origin. My grandparents are the ones that came across to this country. It used to be pronounced Bosiljevac in Croatia.
Well, it was a little challenging, I have to say. So is it okay during our interview if we call you Dr. Joe?
Most of my patients call me Dr. Joe.
I would say. And,
sure.
Of course, everyone should know who's coming in from the health media audience or any audience who joins us here on Herbally Yours. We post all these shows. So if you're catching it now live and there's something you'd like to know, like where to find Dr. Joe or how to spell his last name or how to find his office in Manhattan, you can go on our archives, and all of that and the links will be there for you. And thank you so much for joining us today. Now, you have an interesting history because you were trained in conventional medicine, but you have chosen to also be highly trained in what we might call functional medicine. What made you go towards that decision?
Ellen, that was kind of a progress that occurred. You know, I went through conventional medicine. I was trained, 7 years of training to do vascular surgery, and then I opened up my private practice. And I practiced vascular surgery for 29 years in the Midwest before I came here to New York. And during that time, I would say maybe about halfway through my career, I began to notice some things going on that made me broaden my interest in things. I'll just for an example, you know, patients being sent to me for surgery, and they're on 20 different meds, and I'm looking at that, and I'm scratching my head saying, this isn't right. And then I had a couple patients that were dependent on oxygen because of emphysema, and they went and got intravenous hydrogen peroxide treatments. They came off their oxygen. I had a patient with one swollen leg. He was sent to me for a vascular exam. I went through a complete vascular exam, and I told him, I'm not sure what's causing the swelling, but it's not vascular in nature. This patient comes back months later. He says, well, they put me through a CAT scan, an MRI, a bunch of specialists. He says, I went down and saw my chiropractor. He popped my pelvis, and my leg swelling went away. These are just some small examples of things that started adding up that I began to pay attention to that, and that's what led me into doing, the doctorate in natural medicine.
Well, I think it was an excellent choice. And you say that you belong to ACAM. I was the head nurse for Dr. Serafina Corsello for 20 years. And she had two very, very big centers, one in Huntington, Long Island, and one in Manhattan. And she was one of the originators of ACAM. So she and I helped her with a lot of the background work in putting that particular organization together.
Okay.
So it's very nice that you're a part of it and that, you keep those kinds of therapies intact.
Well, and, I remember when I got the doctorate in natural medicine, patients would come in and they'd say, okay, I've got this cold. What herb do I take? And I go, no. The deal is, you've got a human machine. That's what I like to think in terms of the human body. It's a human machine. There's something wrong with the machine. That's why you got sick. That's what I look at as far as natural medicine. And that's what I look at as far as my background in conventional medicine. Wide background as far as my surgical background gave me an idea of a lot of different things that were being done in conventional medicine. But then when you add that to the natural medicine, the combination of the two, they don't have to be alternative methods at all. They can be complementary.
That's the best word. Because certainly there's plenty of room and the right time to use what would be considered conventional medicine. We don't ignore it. It's on Earth also for a reason. But it seems like with the focus on being that the first intervention, where sometimes there could be something that will just help the body be in balance, like you mentioned, a chiropractic adjustment, a change in diet. I think those things are just too often ignored in conventional medicine as a potential first step with very good outcome and very low potential for adverse effects.
Well, and another example I'd give you is, right now I'm just doing a longevity and wellness practice. So patients will have their usual primary care physician. They're coming to me for a longevity consult. And here's a typical patient that I have. Mid-50s, a man in his mid-50s, maybe a little bit of a paunch, but not too bad. And patients say that he looks good for his age. And he exercises, he tries to eat right. And he's sitting across the desk from me, and I say, well, tell me about the state of your overall medical health. Oh, doc, it's pretty darn good. I said, okay, what medications are you on? Well, I take a cholesterol pill, and then I take a blood pressure pill, a little heart pill. Oh, they started me on something for my blood sugar, and Viagra helps me every now and then. And I look at him and I say, and you consider this healthy? And many times the patient will look at me and say, doc, on my most recent physical, I was told all my numbers are good. Not realizing that the elevation in the cholesterol, the blood sugar, all of these things can be chemically and hormonally related. And that's what, instead of covering things up with a pill, you've got to look at the cause.
And in your practice, I really like that you're calling it longevity medicine rather than anti-aging, because it's not like we're going to be stopping progressing in years, but we can age really in a healthy manner and feel great.
And the thing is, it is very important because I'll tell a guy, you take a group of 60-year-old men today, and you get an average testosterone level. You compare that with a 60-year-old group of men back in the 1950s. Their testosterone levels were 35 to 40% higher than ours today. So what you look at is not these numbers that they have listed, this is the normal range. You've got to look at, this is premature drop in hormones leading to premature aging. So all we're doing is trying to undo stuff that we're doing to ourselves.
That's so true. And I want you to know, listeners, that, You are listening to Herbally Yours on the voice of Nassau Community College, 90.3 WHPC. I'm Ellen Kamhi, the natural nurse, and my guest today is Dr. Joseph Bosiljevac, and he has written a beautiful book called Surviving Cancer. And we are continuing our discussion right here on 90.3 WHPC. So, Doctor, let me ask you, why did you choose this particular topic to write a book about, surviving cancer?
This book actually is based on a story, a patient of mine who probably played the biggest part in me changing over to natural medicine. Donna was a stage 3 cancer patient, and she was sent to me because she had had a mastectomy 6 months prior and a short course of chemotherapy. She was sent to me because below her mastectomy scar, she had these nodules come up on the skin. Well, obviously, those were local cancer recurrence in the skin, and I biopsied that to prove that. And I sat down with Donna and her husband, and I said, Donna, we need to do a wide excision, do some skin grafting. You're going to have x-ray treatments and chemotherapy. And she looked at me and she says, Doc, no more mutilation, no poisoning, and no burning. I says, well, Donna, what are you going to do? Well, I'm going to try some things on my own, and I just need someone that can follow me, do some interval lab work and that sort of thing. I said, well, Donna, and this was before I did anything with natural medicine. I said, I don't know anything about this, but I'll be glad to follow you. So I learned with her along the way. I mean, things that would cause these things to flare up, and she'd do something and they'd go down. And, you know, today, Donna is 24 years out from her original diagnosis, and I can't find any sign of cancer. These skin lesions went away, a whole bunch of things went on. And so she's in the book, and what I did was I took the middle third of the book is actually Donna's story in her own words, what she went through, what she had to struggle with, and what went on. And that's what I like to share with patients because they can understand more from that standpoint what has gone on.
Well, we're so lucky that you did, in fact, write the book, because then it's there for so many more people to understand. We're just going to take a 1-minute break right here, and want to remind you listeners, you are listening to Herbally Yours on the voice of Nassau Community College, 90.3 WHPC. Listen live or online at ncc.edu/WHPC. For more information on today's guest or topic, email whpc@ncc.edu. Stay tuned. Herbally Yours will be right back.
Hope you enjoyed your meal. And I just want to say, he's lucky to have a brother like you.
Lucky? Caring for my brother is far from easy. Waking up every day, lifting him from the bed to the wheelchair to the car to get him to therapy on time. It's no small task between the doctors and the diagnosis, but nothing can disable this love. This is my big brother, my hero. He's part of me, like my arms and legs. So I'll be his. See, there's no time for tired. This starts again tomorrow. He'll be waiting for me. I wake up for him. I know he needs me, but I'm the lucky one. Even though I need help now and then.
If you're caring for a loved one, visit aarp.org/caregiving for care guides and community, or call 877-333-5885. Caregiving Resource Center. Support for your strength. Brought to you by AARP and the Ad Council.
And greetings. Thank you for coming back once more to Herbally Yours right here on the voice of Nassau Community College, 90.3 WHPC. And we meet with you in person. Restoration Farm, right there in Old Bethpage, hosts many of our walks where we go outside and gather wild edible plants and make them into medicine. So you can contact Restoration Farm to find out, or go to naturalnurse.com calendar to find out more. And we'd also like to thank Health Media, who always holds Naval Expo at navalexpo.com, and you can find out more at their website about the many